Folks, thanks for coming on the line with us today. My name's John Dubas. I'm a Vice President of Agent Success for Premier Marketing, and we'll be spending the next 45 minutes or so discussing an option you have that enables you to market Medicare Advantage programs on a year-round basis. This is one of the niche markets that is of particular interest to agents who want to reach out to a community that is in very dire need of our help, but is also one that is very receptive to what we have to offer. And those are folks that qualify for chronic special needs programs. Today's presentation is being recorded, and all those who have interest or all those who have made note of today's webinar will be receiving follow-up, including a link to today's recording and additional follow-up information as well. Give you a little bit of background information on Premier, just as a level set. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Program with offices across the country. We're an insurance wholesaler that offers the highest possible independent insurance agent contracts at the highest possible contract levels, commission levels, and recruiting contracts available where folks qualify. As I mentioned, we were founded in 1968, so that means we just celebrated our 50th year of existence. It's an achievement we're very proud of, and it's a notable achievement that a small family agency in a rural town in Nebraska can grow to be one of the largest organizations of its type. We are the largest producer for Medicare Advantage programs with a number of carriers, including United Healthcare, Anthem, Meridian Care, and then a number of other carriers that are about to be announced as the 2018 numbers are finalized. This gives you an indication of some of the breadth of our partnership within the Integrity platform with offices across the country. And it's a program that offers a full insurance portfolio, including Medicare programs in the Medicare Advantage, Medicare Supplement, and prescription drug areas, along with a portfolio of life insurance and annuity products that include final expense, pre-need, long and short-term care, disability income, and ancillary products, some things such as dental, vision, hearing programs, critical illness cancer programs, and hospital indemnity programs as well. That full Medicare Advantage portfolio includes all of the big boys that you know of, and many of the strong regional carriers as well. That carries over into the standalone prescription drug arena as well, where all of the large national carriers are part of our offering. And then when we get into the Medicare Supplement world, you have a great selection of programs there as well. When you speak to some of the extra needs that the folks that we visit with have, we offer a full portfolio of products in that area when you speak to the ancillary products that help fill the individual needs of the folks that we visit with. When we speak of SNP programs, so special needs programs that are part of a subset of Medicare Advantage offerings, we're talking about programs that came about because of legislation in 2003 through the Medicare Modernization Act, which created a plan to address the needs of certain vulnerable groups of Medicare beneficiaries. This has been addressed in additional legislation throughout the years, but it is a program that was set up to visit with and address the needs of people who have specific diseases or characteristics and tailor the benefits to the needs of those individuals. When we look at the types of special needs plans, there are actually 3 special needs programs created by this legislation. One deals with the chronic special needs program that we're going to discuss today, where individuals can have an illness in one of 15 different categories, sometimes subsetted into 3 different categories. But these are programs where if a person has one of these illnesses and can qualify for one of the programs that are being offered, it's made available to them. An additional type of special needs program deals with folks who live in an institution or require nursing care at home. These are the institutional SNP programs. These are not as widely available And for those of us in the broker world, generally when they are available in a particular market, they are generally marketed only by captive agents of a particular insurance company that offers that particular program. And then, of course, the third category of special needs programs deals with dual beneficiaries, the folks who have both Medicare and Medicaid. So folks who have qualifications based not only on having the base Medicare health insurance, but also the Medicaid assistance. When we look at the chronic special needs programs, just because there is a condition listed doesn't necessarily mean that is available everywhere or anywhere for that particular circumstance. To be eligible for a chronic special needs program, you have to have the same base qualifications that you have with Medicare Advantage programs. You got to have Medicare Parts A and B. You got to live in the area where the plan is approved to operate, live in the service area. You have to have the illness that is detailed in the program and have that condition verified by a physician, and you cannot have end-stage renal disease unless that is the type of chronic illness program that is being offered. One of the things that is very important for us to note and why we would look into this program specifically now as we get into open enrollment and lock-in is the fact that folks that qualify for a CSNP have a special election program that is available to them per stated illness. So what I mean by that is if a person has an opportunity to join a chronic special needs program based on cardiovascular conditions, and they do, and then a period of time throughout the year they decide, well, I have another program because I'm also diabetic that's available in my area, and I feel that that would better suit my needs, they can actually use the chronic SNP SEP for that as well. So it's a program that gives them a one-time per year SEP per illness of available programs. The plan does start then the first of the month after they enroll, much like you see in many of the other Medicare Advantage programs. And it's important for us to note because while we have recently came out of the very active annual election period, much of the production that we have in the Medicare Advantage world is year-round, and it's a grand opportunity because when we look at the Medicare population itself, many of the folks that are part of that program have the base underlying programs or base underlying illnesses that qualify them for these types of programs. What we see most predominantly in the chronic special needs arena are programs that are based either on cardiovascular problems or diabetes. And most of the folks that are on Medicare, the vast majority of folks actually have one of these conditions. When we look at the sales opportunity overall, in addition to the baby boomers aging in, you'll see that the vast majority of the seniors that I've mentioned, or the Medicare beneficiaries, I should say, have one chronic illness, and many of them have more than one. We also run across a situation where folks may qualify for a special needs plan based on income and assets, and what we have to do then is determine which of the programs that they are eligible for best suits their needs. And that's where our expertise as independent insurance agents come into play. To kind of reiterate that point, we're dealing with a population that has a lot of health concerns and then in many circumstances also has monetary constraints that make a big difference as to what their choice of healthcare is moving into the future. And these programs, the Medicare Advantage chronic special needs programs, give us an opportunity to help the folks year-round as we run across those individuals. All that said, how do we determine what chronic special needs programs are available in our area and in our particular market, and how do we detail the differences between these programs? That's where we go into the use of Medicare.gov once again and go to visit this particular website select health plan choices, visit the special needs area, and pull up the plans that are available. So let's do that, because when we go into programs such as this, we'll see the different carriers that will have their description of special needs programs. And you'll see that the majority of the large programs do have chronic special needs programs available. Humana offers them, United Healthcare offers them, Cigna HealthSpring offers them, Anthem offers them, just as examples. So how can we find one that is in our particular market? Well, let's use Medicare.gov to do that, and let's find health and drug plans to get some specifics for our particular market. This gives us an opportunity then to go in and do a comparison of programs, not only within the chronic special needs area, but also with the programs that are available overall. Because one of the things that we have to be very cognitive of is the fact that just because a program is labeled as a special needs program for someone with a particular cardiovascular challenge or diabetes or whatever the qualifying illness happens to be, we need to look at some of the determining factors of what makes a plan a person's probable best selection. So let's go into, let's say, an area here in Texas. Let's go down into the Houston area, North Houston, and pull up the plans that are available there. Because what we're doing now is looking just to locate programs, not necessarily to determine what might be the best choice of a plan for an individual, we can be kind of apathetic in our approach here, and ignorant and apathetic, and go in and do things on a general basis and not add in medications at this particular point in time. It's really important to note that as we go in and we look at the special needs plans themselves and we're doing an evaluation for a prospect or a client, we obviously want to input all of their medications, because that is one of the factors that makes a difference between these programs. You'll note any special needs plan as designated by the government, these are programs that have to be an MAPD program, where the medication coverage is integrated into the plan itself. So you don't have a medical-only program that qualifies as a SNP. When we go here into this category, we can see the three different types of of special needs plans that are available. We're going to select the one with certain chronic or disabling conditions. We're going into the programs with drug coverage, because those are the ones that will give us this category. If we didn't put this in here, it would only pull the regular MA plans. We let it think for a moment, and then it's going to give us the results. This is a North Dallas zip code, North Houston zip code, fairly populated area, so you have a higher probability that programs such as this would be available. In many of the more rural areas, you'll find that much like you'll have with regular Medicare Advantage programs, perhaps your choices will not be as numerous, or they may not be available at all in a particular area. There are 38 Medicare Advantage prescription drug programs available in this zip code. Let's look at them all, and let's see how they lay out for us. One of the first things we do here is we see that there are a number of different types of Medicare Advantage programs. How can we tell the difference? Well, here we go. If we got an HMO SNP program, this is a designation that this is a special needs program based on the parameters that we had in the search. So it's a chronic special needs program, where the second program here is just a standard Medicare Advantage program. Why does that make a difference for us? Well, in order to utilize the chronic special election period, get out of jail free card, so to speak, It has to be into a program that is a chronic SNP plan. So we'll see that we have 1, 2, 3, 4, 5, 6. There you go. That appears to be our selection. So out of the Medicare Advantage prescription drug plans that are available in North Houston, of the 38 plans, 6 of them are chronic special needs programs. Going into the detail of the program further, it gives you an opportunity to go in and get some of the specifics that you need for the programs. With today, we're not going into each plan in depth to tell you the differences between one carrier's offering versus another. I don't think that'd be fair in as short of a presentation as we're giving today to give you accurate information. One of the things that we would strongly recommend that if you become involved with offering these programs, you do the necessary background work in order to make certain that you are properly explaining the programs and that you have all of the detail that makes these a proper choice for an individual that you're offering the plan to. It gives you then also the opportunity to go in and explain the differences between the choices that an individual has with their health care selection moving forward. Many folks will be locked into their choices that they made at the end of the year. Some folks will have this option or many other options that might come into play that would be a viable choice for them in selecting their health plan moving forward. One of the things that I really want to emphasize in these special needs programs is the fact that the drug programs may be laid out differently one plan to another, and that's why it's so important for us to have the information from our prospects without looking or appearing to be underwriting the programs, because we're not. We're just gathering the information that's necessary to help them make a decision. But the carriers may have medications available on the formulary, but different carriers may have them in different tiers, and that can make a huge difference as to the overall cost effectiveness of the program that they are selecting based on the cost of those medications and what they lay out in the different tiers that are available to them. So one of the things that we would want to do when we look at these different programs and look at the opportunities that we have, well, what is the best choice? Well, as I mentioned, we have to look into some of the differentiators between the programs. Many of them come with different extra benefits. We're seeing now with some of the legislation that allowed many of the carriers to get a little more creative with some of their benefits. You have a grander selection of some of the extras that a person may have, and that might include an over-the-counter benefit that would be appropriate for a person with a particular condition. It may also be an opportunity within a particular plan to have additional regular transportation. So there are a number of different opportunities to look at outside of the dollars and cents of a $5 versus a $6 copayment for primary care versus a $0 or whatever. So some different things that can come into play that can make a difference based on that person's particular circumstance. And then, of course, what we also have to be very cognitive of is the fact that if a person qualifies for a chronic special needs program, well, they're probably seeing different specialists and other providers to address the issues that they have with that particular illness. And so we want to make certain that we pay attention to the providers that are available, not only the folks that they're currently seeing, but also other providers that may be necessary in the future. If you've got somebody with a cardiovascular condition, they may be seeing a particular cardiologist, but in the future, they may have a need of an electrophysicist or physiologist, I guess is the proper term. And so we have to look at not only what we are dealing with now, but the possible future needs of an individual and make certain that they are comfortable with the choices that they have of the providers that are going to take care of them now and moving into the future. One of the other things that's really important is the carrier support. Many of the carriers that have a large book of business in this particular area are very adept at taking care of these people. And you'll see that most of the folks, because of the way that the government requires a company to set up a plan because of a chronic special needs designation, they have to have a model of care that is put in place to address the issues that a person has for their underlying chronic illness. And you'll see very many carriers now will introduce a telehealth component. You'll also have folks that have a specific dietary addressment for folks that are diabetic or to help with different cardiovascular challenges as well. And you'll also see some carriers that are much more adept at being very helpful with you in not only getting the person enrolled, but also making certain that the enrollment goes through and processes and accretes. And what I mean by that is, we noticed on one of the earlier slides that one of the requirements for a chronic special needs program is having that illness verified by a physician. And when you put in an application for a chronic special needs program, and many of the carriers allow you to do this electronically now too, which I would strongly recommend to make certain that you have everything you need in the process of writing one of these applications. But it then gives you a specific time period where the diagnosing or attending physician has to verify that condition. So we have a 31-day period in which to verify that, and that's one of the things that many of us that go back to the old life insurance days and the attending physician statements realize that this is a component that we have to be very aware of and we have to stay on top of in order to make certain that we're properly servicing and getting these people into the programs that they have selected. Some of the additional things that you then have from us here at Premier in order to make these programs accessible to you, we do offer you some assistance with errors and admissions coverage. This is a discounted errors and admissions program that enables you to be a true independent insurance agent, where it's not a blanket program that only protects you for the contracts that you have contracted through a particular hierarchy, but covers you across the board. We have a discounted means of doing continuing education as well, an electronic means of contracting with multiple carriers where you set up an agent portfolio and then also then select different carriers one by one, and it electronically fills that contract out for you. Other means of training and tips as to how to market and how to become more adept at different types of programs, including different types of grassroots programs that can get you in front of the chronic population. And this includes dealing with different providers, which is a great way in order to address this population, and then different support groups for these types of illnesses as well. We also offer additional electronic means of quoting and enrolling an individual into different insurance programs, a way to put your social media marketing on autopilot through Coverage Made Easy, a small fee each month. We'll put compliant pieces out there for you with your approval. And we have a different portfolio of lead programs available to you as well that can help you market to folks on an ongoing basis. And this is an area where with chronic programs, many of the community-based programs are very, very effective for you. You'll have a great interest in different faith-based organizations that address this particular population, a great way for you to go out there and do things on an informational basis, set up additional follow-up marketing opportunities based off of that activity as well. We also offer different direct mail support. There are a number of direct mail pieces that directly address this particular special election period that have been very effective. And it's a situation where we want to work with you hand in hand in order to make this effective. And in order to do so, one of the things that we want to make certain that you're aware of is what is available in your particular market. So one of the things that we're asking of you as we do the follow-up to today's presentation is, as we reach out to you, you let us know of the particular markets that you are in which you are active, and we will do an analysis for you of the different programs that are there. If you are in a more rural area, it may be a fairly quick analysis. There's nothing there. Or it may be an area where, for example, in certain parts of California, one carrier in part of California offers 8 different SNP programs in one particular area based on different illnesses. So it is a varied response, but it's one then that you can use to tailor a portion of your marketing program based on the offering of this particular product. And as I mentioned, one of the things that we would do then is make certain that the carriers that offer those programs, you're familiar with the requirements that they have in order to offer these programs, the contracts that are available, and the different training that they offer and the support they offer in your particular market. One of the things that we're seeing with many of the carriers now is the local market support with agent broker developers in a particular area that will work with you on a one-on-one basis to help you develop this particular niche market. You'll see it not only with the chronic special needs program, but for those folks who are also active in the dual market as well. I think that's one of the things that we really want to make certain that you see the difference in this particular circumstance, is this is based on different health circumstances, not on different economic factors. So many times folks will be hesitant to work with the dual special needs products because sometimes those folks, well, they don't necessarily have the means to purchase additional products. These folks, the qualification is not based on their income and assets. It's based on a certain health condition. It doesn't necessarily mean they're sick. They may still be able to qualify for other programs and have the means to offer those additional programs as well. So you have an opportunity then to grow your business on a year-round basis. As we go through and do some follow-up, I'm going to make certain that we give you the detail that you need for your particular market. That said, we went through today's presentation much more quickly than I anticipated, but it gives us then an opportunity to analyze as to whether or not this would be a strong part of a component of our marketing program to move forward. And once we have determined that it would be, we just need to pull out that round to it and get to it. This is the contact information for the marketing department here at Premier Marketing. You can reach any of the marketers at 1-800-365-8208. The contact information listed on the screen now is for our Texas office. Dialing into the 800 number will get you in touch with any of the Premier marketers with whom you are working, and we'd be pleased to offer any assistance that we can in order to make this a viable part of your overall marketing efforts. And pardon me, I'm checking to make certain that we have questions and that we answer them. One of the questions is, did you say we're going to send out an email? Yes, you're going to be receiving follow-up to today's presentation with a link to the recording of today's presentation and a PDF of the presentation itself, along with some additional material pertinent to today's presentation. Pardon me as I go through some of the other questions. Do we offer website development? Our organization does not offer a true website development, There are different types of programs that we have that we would recommend with outside vendors that do so. One of the questions is, don't the CSNPs have specific conditions that they cover? Yes, that goes back to one of the earlier slides where the person has to have one of the 15 different types of conditions in order for a plan to be available, and then a plan of a certain type has to have that condition covered. So you'll see in many areas a program that will deal with chronic heart failure or congestive heart failure or diabetes or a combination of the two. And those conditions would then also have to be, as I mentioned before, verified by a physician. That said, that appears to be the questions that we have today. Watch for today's follow-up. We'll make certain that we reach out to you and get you some additional information on details specific to your market, and we look forward to visiting with you in the very near future. That said, we wish you good selling. Thanks so much, and we'll talk to you soon.